Once COVID restrictions are lifted, Ontario hospitals will be dealing with a backlog of more than 257,000 surgeries. A startup out of Sunnybrook Hospital says a new tool that they developed could help get patients into the operating rooms faster when it comes to breast cancer surgeries.
Molly is essentially a GPS system. It's a magnetic seed, and then it's a probe that we use in the operating room to find that magnetic seed.
Molly Surgical is used on patients who have breast cancer tumors. Ahead of surgery, a radiologist puts a magnet about the size of a seed into the patient's breast to mark the location of a tumor. Then in surgery, doctors use a probe to find the seed magnet and the tumor, both of which are then removed. This has been piloted on 20 patients at Sunnybrook. Dr. Francis Wright says it's a much better option than traditional wire-guided location, which is used at many hospitals.
They put a wire into a lady's breast. Part of the wire is hanging out of the breast. It's uncomfortable. It can move. It's not as accurate.
Molly also has additional features.
On the little screen that we have, it tells us exactly how far away we are in millimeters from the magnetic seed.
The surgical tool is coming at a stressful time for the healthcare sector. A study of Ontario cancer surgeries found there was a 60% drop in procedures when the pandemic began a year ago. Hospitals were forced to reallocate resources like beds, ventilators, and medical staff to prepare for the influx in COVID-19 cases. More than 35,000 cancer patients in the province had their surgeries delayed last spring. With hospitals having to halt all elective surgeries once again, the co-founder of Molly Surgical and former medical physicist at Sunnybrook, Anand Ravi, says he thinks his invention will help get through more breast cancer surgeries than the current methods.
To deliver breast conserving surgery, it's like a three-legged stool. You have radiology, surgery, and pathology all working in concert to hold that stool up. And so it's a highly complicated system where everybody's juggling and trying to communicate with each other.
Molly will allow people to work autonomously.
Radiology can now see more patients and increase capacity on their own because they're not linked to surgery. And surgery can increase capacity on their own because they're not linked to radiology, and similarly with pathology. And this decoupling allows for better efficiency and will allow for a better rebound once these COVID restrictions are alleviated.
Molly Surgical's tool has been cleared by the United States Food and Drug Administration and just launched in the States this past weekend. It is currently waiting for approval by Health Canada. At Sunnybrook Hospital, Maleeha Sheikh, City News.